Welcome to the Health Zone. My name is Dr. Toju Chikiobi, but everybody calls me Dr. Toju. On today's episode, we will be talking about cancer screening, a very important subject considering that cancer is on the rise in Africa. So please don't go away, stay with us and let's learn together. Welcome to the Health Zone. On today's episode, we will be talking about cancer screening. And with us here in the studio is Dr. Oge Ilegbune. Dr. Ilegbune is a general practitioner at the Lakeshore Cancer Center here in Lagos. She's actually the head of strategy, development, and outreach. She is passionate about spearheading the eradication of cancer in Nigeria, and in particular focuses on cancer prevention and cancer screening. We're truly honored to have her here in the studio with us today. Dr. Ilegbune, welcome to the Health Zone.
Thank you very much, Toju. It's a pleasure to be here.
Thank you. As we do, we have a tradition here in the Health Zone that before we get into the meat of what we're talking about, we go out on the street and see what the average person knows about that subject. So we'll do that now. We go out and see what the men and women out there know about cancer. So we'll be right back. Don't go away, join us.
I am aware of breast cancer and prostate cancer.
Well, I hear a lot about breast cancer, so I guess that will probably be the most common.
I know cancer is a disease, is a killer.
Yes. What kind of cancer? Colon cancer, breast cancer, even cancer of the back or something like that.
No, I don't have anybody. I don't have anybody with cancer.
I know two people who had breast cancer who died.
Well, for some of them, they found out late, and they eventually died, unfortunately.
We should not take sugar too much. And even the water that we drink, we should know that that water is very pure.
Change your diet, exercise, bring down your body weight.
I saw something on Google one time that you reduce the amount of time you have sex. Yeah, sex too is a problem in cancer. They said that too much of it causes cervical cancer.
I don't know.
I think it's the cancer of the cervix, in women especially.
Cervical cancer is cancer of the cervix.
I don't know.
Mammogram is when you test the breast for cancer.
Yeah, a mammogram is a test for checking lumps in the breast.
Welcome back to the Health Zone. So Dr. Ilegbune, we've just been watching people on the street tell us about cancer, and quite a few people knew people who've had cancer. So please tell us, what is cancer?
Thank you very much, Toju. That was very interesting to listen to. Let's imagine that the human body is made up of cells, okay? Cells are very small units. Every one of us are made up of cells. And what happens is, normally, the cells will grow, they will divide or multiply, and natural progression, they will die. But what happens in cancer is that these cells become abnormal. So cancer is when you have a huge amount of cells, which ideally should be normal, becoming abnormal, in simple terms.
What causes cancer?
Well, you could say that the cause for cancer is multifactorial. In other words, you have different factors. Okay. It's not usually one factor. In some cases, you do find people having cancer, as I say, run in family. So there's a genetic component. Okay. Some what we call mutations, so changes in the cells in the body that occur in some families. Other factors that could cause cancer are, in a way, risk factors that are somewhat under our control.
Okay, like
so
what?
Lifestyle factors, the food we eat, so diet, things we drink, alcohol,
Yes.
things activities that we engage in. So smoking is a major one.
Yes.
Also, certain exposure to sex. So we have what is called a human papilloma virus, which is transmitted through sexual intercourse. And what happens is this virus, which is like a bug, begins to cause changes within the cervix. And that can lead to cancer formation.
Oh, so a lot of different things, but there's some
A
of
lot
it that's under our control. I like
Some
the
of
way
them
you
are
said
under
that.
control.
You know, that's good.
Yes.
So who's at risk therefore for cancer? Who's at risk for cancer?
In a way, you could say everyone could be potentially at risk.
Okay.
So you do have people who are at a high risk because there is a family history. So
Okay.
already there is an innate sense of being at risk of
Yeah.
cancer. But for those of us who don't exercise, who don't take time to look at our diet, who are not particular about our recreation, whether it's our sexual habits or our smoking habits.
So what is important about cancer though? Why should we in sub-Saharan Africa be paying attention to cancer?
We have a problem in sub-Saharan Africa because of our, again, let's call it poor health infrastructure, health systems. What this results to is that we don't have screening, which would help detect cancer really early.
What do you mean by screening?
So
What is screening?
Screening are, you could say, examinations and investigations that could help the health professional, even you as an individual, pick up cancer early on.
Okay.
And stops us, patients presenting at an advanced stage. So there are different ways to screen. Okay. The most basic thing, if we take, for example, breast cancer, is for every woman, from the age 21, 25, really, to do a self-breast examination. Very straightforward, once a month. And what this helps you to do is get so used to your breast that
so you know when there's a change.
When there's a change, just
Absolutely.
like women makeup, and
Yes.
you notice when you have a pimple, you notice when there's a difference.
Yes.
The same thing with breast examination. You can do that and get used to the way your breasts are.
Okay.
If there's a change, you can go to someone. So there are various ways you can do that.
Well, we'll talk about screening a little bit more because I want us to really break down screening for the
That's
audience.
fine.
But we'll take a quick break now and we'll be right back. Don't go away. Stay with us. This is really good stuff. We'll be right back. Welcome back to the Health Zone. Today we're talking with Dr. Oge Ilegbune about cancer screening. So Dr. Ilegbune, we're talking about cancer in Africa. So tell us a little bit more about why it's important to us here.
Well, we have, in a way, a global burden of cancer in the world. So when you look at cancer, cancer occurs everywhere in the world, but statistics have shown that the greatest burden seems to be here, especially sub-Saharan Africa. Mm-hmm. And we find, in terms of numbers, that we have over 715,000 cases every year.
Wow.
And about slightly over 500,000 will die from cancer. And yet, some of these cancers are quite, I wouldn't say easy, but they are easier to treat when detected early.
Okay.
And you find that people can actually live quite long. So in terms of early detection, you would have about 90 to 95% of people going ahead to have a good life.
So we're going to talk about some facts about cancer. In sub-Saharan Africa, the number one diagnosed cancer in men is prostate cancer. However, the number one killer cancer in men is liver cancer. In women in sub-Saharan Africa, the number one diagnosed cancer is breast cancer, But surprisingly, the number one killer for women is cervical cancer. And as we talk about screening, it's going to become a bit clearer why that is the situation. South African women have the highest breast cancer incidence in all of Africa. And overall, if you take all the cancers together in Africa, cervical cancer seems to be the number one killer. Men, if you include cancer in men as well. So these are very, this is serious stuff. So let's talk about the signs and symptoms of cancer, and then we'll camp on screening for a while. Okay. So what are the signs and symptoms of cancer?
Well, signs and symptoms. So I'll explain what those mean. So with symptoms, these are, you could say, signals that the person can feel and say, oh, I can feel that something is not right. It could be something they are feeling in terms of touch, or something within they feel unwell. And with signs, this is what the health professional in the examination would find out. So some signs and symptoms would include things like just generally feeling unwell, fatigued, tired. Mm-hmm. You could find a weight loss. The person begins to lose weight even before they've noticed that there's something else. Other signs could be bleeding. So if it's from, for instance, from the cervix, the person's first sign, impression would be, oh, I'm bleeding. Or if it's from the womb as well. If it's from, say, the colon, so the bowels, you could find that you've noticed a change in your bowel habits. With the breast, again, it could be suddenly you notice that from having nipples that stand out, you suddenly notice that they've retracted. In other words, they've gone in. Mm-hmm. Or it could be that you suddenly develop a rash around the nipples as well. So there are quite a few symptoms which you could have.
That's really good. We'll take a short break now and we'll be right back. Welcome back to the Health Zone. Today we're talking with Dr. Ilegbune about cancer screening. So Dr. Ilegbune, talk to us about the different screenings that there are for cancer and just in general terms about screening.
Okay, so screening is a way to help detect the cancer early on. And this can be done for both men and women. So it's not just women, because for some reason we think breast cancer is the only cancer, but also for men. And screening can start at certain ages, so it's not a case of, okay, once you get to 60, then I can start screening. So with women, the emphasis is on screenings that affect the breast, the cervix, the colon. And from actually the age of 21, you can start doing some screening yourself at home, and that would be things like the self-breast examination. However, we also have a screening method called the pap smear, which has to be done by a health professional. The pap smear or the liquid-based cytology are also methods of cervical screening. In addition, it's also advised that women should, at least once a year, from about the age of 39, go see a doctor for a proper clinical breast examination. So every month you do your own self-examination, but every year you see the doctor, because there are things the doctor looks out for as well that you might not notice when you're doing it yourself. Now, for breasts, you find that women can do breast examination, clinical breast examination, but from the age of 40, you need to have a mammogram. Again, we listen to some people on the street. Some people know about it, some people don't. Yeah. With a mammogram, it's an X-ray of the breast. So a radiographer will do this, and the radiologist will have a look. These are specialists who can then look at the film. It's like taking a picture, and it can detect if you've got lumps, or if you have lumps, whether these are lumps we should worry about. Yes. Because there are lumps that are not cancerous. You know, we call it benign. It means not harmful. So if the mammogram isn't ideal, you can do a breast ultrasound as well, which can help. And in some cases, you find people who have had a mammogram, but there's still a bit of you know,
They're not clear
it's
about
not very
the
clear,
yes.
and you find that you have to go
Yes.
and have the breast ultrasound done.
Yes.
So again, from the age of 40, every woman should have a mammogram at least every 2 years, right up until about 70, the age of 74. Again, with women, you have the test for bowel cancer screening.
Yes.
This is done with the older, slightly older age from about 50, even though in Nigeria we actually do it a bit earlier. But in the West, it's really officially from the age of 50. And this involves a stool test, stool occult, which is trying to find blood in the stool. So the stool tests for bowel cancer is for both men and women.
Yes.
Again, for men, we should be thinking about prostates.
Yes.
Again, we've heard about the statistics. Prostate cancer is quite, you know, we have it here in
Yes.
sub-Saharan Africa. Black men, even in the West, once you're black, you're encouraged to do that. So, you know, that's again is from the age of 40 upwards for men.
And I understand also that if there's a family history, then you really need to bring these ages down a bit.
So both with breast cancer, both with prostate cancer, if you do have a family history, you should be speaking to your health professional, your doctor, to say, you know, I have a first-degree relative, aunt, mother, sister, and certainly these tests should be done earlier. So, you know, for the mammogram, instead of 40, waiting for the age of 40, you probably would be having that much earlier.
Okay.
Okay.
That's really good. Thank you. I mean, you've really covered all the screens. And for where can you go to get these screens?
Right. In Nigeria, that's a challenge. We don't have an organized national system of screening where every 3 years you get a letter in the post, every 2 years you get one for mammogram, you know, that sort of thing. There are areas here where you can be screened. So in the primary healthcare centers, you know, they do some screening, but again, it's a bit epileptic. It's not regular.
Yes.
Some private hospitals would screen as well. Some NGOs have taken up the call to do that. But again, these are non-profit, so they rely on funding. So it's not a continuous thing, which screening ought to be.
Yes.
Some teaching hospitals do that as well. But I think the problem out there is that the education isn't happening. So people, the general populace, are not aware that when I get to 40, I should actually be having a mammogram. Now I'm 21, sexually active, I should be having cervical screening.
Yes.
I should be having clinical breast examination, that sort of thing.
Yes.
So, you know, it's a difficult one, but I think all health providers, doctors, nurses, anytime you meet patients, use the opportunity to educate them, and then you can cross the bridge of, okay, where do we go at that point?
Okay. Terrific. That was really great information. Thank you very much. So we'll take a short break right now, and we'll be back. Stay with us. Welcome back to the Health Zone. On today's episode, we're talking about cancer screening with Dr. Ilegbune. So, Dr. Ilegbune, can cancer be prevented?
Yes, cancer can be prevented in the sense that you can try to detect it early, okay? There are cancers that will be there regardless in a way because there are things that we don't have under our control. So family history, for instance, environmental, you know, pollution, that sort of thing. But there are things within our control that we can do to help. So we would look at our lifestyle generally. So that would include diet, that would include maintaining a healthy weight, that would include exercise, you know, again, reduction in alcohol intake, smoking, which is a major risk factor because it doesn't just cause lung cancer like most people think. It actually cuts across different parts of the body, bladder, you know, skin, mouth, tongue, that sort of thing. So those are under our control. And you know, there are also preventive measures we can take. So I've mentioned sexual habits, using condoms, you know, so safe sex education is not just to stop people from having babies earlier on, but it also stops you not just from having STIs, which is sexually transmitted infections, but things that lead to cancer formation, like the HPV virus. So condoms would help. Again, certain vaccinations, so you can be vaccinated against the HPV virus, so that would come for young women. At the moment, it's really for young women from about the age of 11.
Okay, great. We've heard a lot of people say that cancer, you're just going to die. So tell us, can cancer be treated?
Well, I was listening to the lady on the TV who said cancer is a killer.
Yes.
And it's unfortunate because most people in our country present in the advanced stages where even with the health professionals, the treatment options are quite limited.
Yes.
And, most people then go on to die, which is where this whole idea that cancer kills. But the honest truth is 1/3 of cancers are preventable, 1/3 are curable, and then 1/3 can be palliated. In other words, you can help symptom control, quality of life. The treatment would depend on the stage, and that is a fact. So the earlier you present, the more options there are out there for you. In some cases, because of the screening, you as a patient, you haven't even noticed that there's something wrong, but these screening methods then pick something up. Immediately, you find that something can be done, whether it's surgery, whether it's chemotherapy, whether it's radiotherapy. So,
tell us what those are. What is chemotherapy?
Okay, so chemotherapy is where you use drugs, medication to help to kill the cancer cells. It targets the cells and that's what it is. Radiotherapy is where you then use rays, so a bit like X-rays to again locate the cancer cells and try and kill them as well. Surgery is surgery, so you try to remove the cancer, take it away. In some situations, you can either have one, or you can have two, or you can have a combination of all three.
So you can do surgery followed by
chemo, followed by
radiation
as well. And in all cases, obviously, trying to maintain a healthy lifestyle is still very important.
Terrific. Thank you so very much. There were a couple of, I know there are a couple of myths out there about cancer, and I just wanted you to address two of them very quickly.
Okay.
The first one is the fact that only elderly men get prostate cancer, and cancers in general.
No, unfortunately, well, I don't want to say unfortunately because nobody deserves to have cancer, but the fact is that anyone can get cancer. Anyone. We, are finding younger and younger people, women, coming down with breast cancer, cervical cancer, younger men coming down with colon cancer, and I'm talking about 20s, 30s, 40s.
Wow.
So screening really is for everyone, not just the elderly people.
Okay. Then the other myth that I just want us to address is that if there's no cancer in my family, then I don't have to worry.
Okay, I mentioned earlier that the risk factors for cancer are multifactor. It's not just a family history. There are other things in your lifestyle that can put you at risk of cancer.
Thank you, Dr. Ilegbune. This has been terrific. You've given us so much information. We've learned so much from you. We definitely want to have you back on the show.
I'd love
so
to
we'll
be
ask
back.
you to come back again and talk to us some more.
Thank you.
Well, it's been a pleasure having you on
Thank you
the
very
show.
much. It's been a pleasure to be here.
So we've been talking with Dr. Ilegbune about cancer screening. So please don't go away. We'll come back and I will just do a take home of just the high points of some of the things that she said. So do stay with us. We'll be right back. Welcome back to the Health Zone. Today we've been talking about cancer screening with Dr. Ilegbune, and here's some of the high points she covered. Most cancers are caused by genetic changes that occur throughout a person's lifetime as a natural result of aging and exposure to environmental factors such as tobacco smoke, infectious agents, radiations. But lifestyle factors such as the food you eat, how much you eat, and whether you exercise can also influence your risk for developing cancer. Screening tests help find cancer early before symptoms appear. General signs and symptoms of cancer include unexplained weight loss, fatigue, fever, pain, even some skin changes. But there are some specific signs and symptoms depending on where the cancer is, such as changes in bladder and bowel function, unusual bleeding or discharge, a lump or swelling in the breast or in other areas, trouble with digestion or swallowing, or a hoarseness and a cough. Cancer is very expensive to treat, often requiring a combination of surgery, chemotherapy, and or radiation. You can make lifestyle changes that can modify your cancer risk. Eat a better diet, less fatty foods, more fresh foods, regular exercise, at least 30 minutes a day, maintain a healthy weight, avoid tobacco smoke, limit your alcohol intake, and please practice safe sex. This has been Dr. Chike Obi on the Health Zone, and I'm leaving you with this message. Please stay healthy.